Watch this.
It's a place we've been before during this health crisis. Hospitals scaling back services, specifically emergent surgeries, procedures that aren't necessarily imperative in a pandemic, but they are important to a lot of people. The final vote from Elmore County narrowly puts a controversial doctor on the Central District Health Board. And we're going way out and way back for a Feel Good Friday redial. It took a tour of an ICU at St. Luke's this week for the COVID health crisis to jump to another level for Governor Little. He told us on Tuesday, walking through and seeing intubated patients in critical condition, fighting for their lives, and witnessing the overwhelmed hospital staff trying to keep up, Governor Little told us it was, quote, heartbreaking. Something we've been told for weeks by those same staff members and what we've tried to pass along to you. And how about this time? This COVID surge is putting people who are supposed to be in the prime of their life this close to the end of it.
There are so many of these tragic stories, but I will tell you right now, here in our intensive care unit, we have two young women, one pregnant, one was pregnant. Both of them contracted COVID. Both were unvaccinated, as all these people are who are getting COVID now. They're all unvaccinated. They got COVID. There's now a risk to their own life. There's a risk to the baby's lives, and it's totally unnecessary.
Dr. Emerson said that tragic story is just one coming out of Idaho hospitals as the medical system gets closer and closer to being forced to implement crisis standards of care. It's a major consequence of our medical system being this overwhelmed. It's the simple fact that choices are now being made to determine who gets care and who has to wait. Medical leaders tell us they are pushing off scheduled non-emergency patient treatments so they can just make room and have resources available for the influx of very sick COVID patients that are coming now and are expected to come in the coming weeks. Those appointments and those procedures being pushed back, well, they're not just minor issues. And doctors tell us people are suffering, waiting for care. Here's Joe Paris.
We are at the most extreme circumstance we've ever been in trying to take care of patients.
Idaho medical leaders continue to share what they're seeing inside our hospitals. The medical system is under incredible pressure as hospital beds are filling up with very sick people fighting COVID. A major consequence, procedures and surgeries are being pushed back by days, weeks, and months to make sure there is room for the expected increase in COVID patients.
There are medically necessary time-sensitive procedures and care, and then there is care that can be delayed. So we're in the position right now of identifying care that can be delayed and pushing that off, hopefully through the peak of the surge, which still has yet to come.
Procedures or care that can be put off have been referred to by some as elective surgeries. Some have viewed that connotation, elective, as meaning procedures that are just very minor. Dr. Stephen Emerson, Chief Clinical Officer at St. Alphonsus, says this is not the case and that the term elective surgery is not one they use. Here's why.
What in the mind is elective to somebody else may be very important to the patient. So we resist the use of the term elective.
Nemerson says they examine situations to determine if they are emergent and urgent and make the best treatment decisions they can. Make no mistake, people in our community are suffering because they cannot get the care and relief they need. They may not be at risk of dying, but they will be in significant pain as things like orthopedic surgeries are pushed off.
These are procedures where people are actually debilitated and in pain. And so we're selecting which ones, if they are put off we're looking generally at a period of a month or more. So if they're put off for more than a month, do we think that the disability will be worsened by that? And if the answer is yes, we try and get them in. If the answer is no, then we regrettably put them to the side.
Medical workers are now in a position where they have to tell patients that their care needs to wait.
It's awful. You can imagine the emotional distress that we have looking at a patient in the face and saying, I'm sorry, we can't relieve your pain today. It's going to have to wait a week or two or a month or two. There's nothing much worse than having to do that.
The entire medical system in the state and region is under significant pressure, creating fewer and fewer treatment options. Medical leaders are calling on the community to do what they can to help the situation.
It did not have to be this way. If people would get vaccinated, stay away from each other in social events, and cover their faces, they wouldn't get infected with COVID. They wouldn't be coming into the hospital and taking up space for patients that also need us, that have been responsible, and all they want to do is get their care needs tended to and their pain relieved.
And to be crystal clear here, if you're having an emergency, you should still go to the emergency room. St. Alphonsus, St. Luke's, the medical system here, they're not asking people to stay away from the ER if they're having an emergency. But Brian, it is a situation where it is difficult, and as our ICUs and our hospitals do get busier, there will be a time where they're going to have to make some tough decisions. If 2 ER patients come in at the same time and there's only enough resources to treat one of them immediately, one will have to wait. They do have a system they go through to kind of score and decide who's going to get treatment first or when they're going to get treatment. It's a tough situation. It is, I mean, saying it's a tough situation is really an understatement.
Well, and it's all based on this fact that they can't do everything. They can't cover everyone. And we take this for granted. If I'm hurt or sick, I'll go to the hospital. But the staff is what is taking the brunt of this situation. We tried to talk about this to as many nurses and doctors about how overwhelmed and frustrated they are feeling right now, and you got a little bit of that today.
Yeah, and any frontline healthcare worker I've talked with in the recent months and really even the last year, they're completely honest when they say they are burnt out, this is extremely difficult, and they're wearing thin. And Dr. Nemerson, Brian, told me earlier that the medical workers, they need our support, something that we gave them early on in the pandemic. And I just want you to listen to what Dr. Nemerson has to say here about how valuable the support is and what type of support we could all be giving to our medical community.
I want to see those lawn signs going up saying thank you to those heroes. I want to see neighbors calling up, sending emails, text messages to the people that work with me saying thanks for what you're doing, because they're making more sacrifices right now than they ever have in the entire pandemic. They're working longer shifts, more days, more nights, answering phone calls. I can go on and on, at their own personal expense to keep you well. And it's time for those in the community who are responsible to recognize that and express that gratitude, because that's going to keep people going.
Okay, let me just recap something. At their own personal expense. Brian, you and I go home after our job is over, and we deal with what we deal with here. But imagine being a frontline medical worker for the last 18 months and having to deal with horrible situations, watching people die every day, watching people struggle to just breathe. You do this day in, day out, every day of the week for 18 months. It wears you out. You bring that home with you. They can only do so much.
And they're asked to stay extra longer for their shifts to cover for those people that are already burned out 15 months ago, because that first wave, when we all respected them, we put those signs up in our yard and we sent them food and we did all these things that we are no longer doing. It is amazing. And as you also heard today, and here we are 18 months later, and they're still hearing patients who don't believe COVID is what put them in the hospital.
Yeah, just to wrap up quickly, Dr. Nemerson told me as recently as this afternoon, they are intubating people who are arguing with them as they're getting care, saying that they do not believe in COVID, and others have told me that they've argued with patients who say, you've poisoned me, this is a hoax, I don't know what you've done to me.
It's amazing that they deal with that. But again, all it takes, according to Dr. Nemerson, a little gratitude, and expressing that gratitude for our healthcare workers. Thanks, Joe. All Dr. Ryan Cole needed was one vote to be elected to the Central District Health Board of Directors. That vote had to come from at least one of the 3 Elmore County commissioners. They were the last to put their vote forward. And Dr. Cole got it today. That vote happened just a few hours ago at the commissioners' regularly scheduled meeting. Before they voted, they wanted to interview Dr. Cole themselves since, well, they said Ada County was given that chance and they wanted the same. So they did, and then they voted. 1-2 was the outcome. That interview was enough to sway one commissioner, Al Hofer. And I spoke with him shortly after the vote, about 10 minutes after he voted, and he told me he'd seen the attacks of Dr. Cole over the past few months, but what Dr. Cole is saying, Hofer told me, aligns with what he believes. And he also agrees with Dr. Cole that what we're doing now isn't working, and something different has to be done. So now, well, we'll see if that happens. Dr. Cole is going to replace Dr. Ted Epperly, who served on the board for 15 years and was let go in June, at the end of June. Ada County Commissioners Ryan Davidson and Chair Rod Beck said back then, or just the last month, I should say, they wanted someone who better aligned with the views of the community they serve. So here's how this vote broke down. Ada County was 2-1 in favor of Dr. Cole. Boise County, 3-0 also in favor. Elmore County went 1-2. Valley County went 1-2 against. Both of those were against. Dr. Cole isn't officially on that board just yet, though. That appointment will not be official until Central District Health receives the written votes from Elmore County commissioners. And that would normally happen the next day, next business day. Well, Monday is a holiday, so the official announcement that Dr. Ryan Cole is on the Central District Health Board likely not to happen until Tuesday. It will be an extra long Labor Day weekend for one Nampa Elementary School. Nampa School District says 30% of staff is out sick at Snake River Elementary, and because of that, district says they can't find enough substitute teachers. So the school closed down today, and it's going to remain that way through next Tuesday. They didn't say if the sicknesses were COVID related, but shortage of subs isn't just affecting schools in Nampa. While the Boise School District hasn't had to close a school yet thanks to COVID, the district says some of the schools there are struggling more than others. They're looking to find their own solutions to it as well. For example, Cynthia Mann Elementary recently sent a letter home to parents asking them to step in and become substitute teachers. And if the school doesn't get that help, they say in-person learning could turn into virtual learning if there is a staff shortage.
Certainly, we're going to take the steps that we need to take to be able to continue to protect that in-person learning, which is so important for our students and our community expects that of us.
Well, Holler says typically Boise School District doesn't have any trouble finding substitutes on their staff, but through the pandemic, Holler says the district is able to substitute staff just 65% of the time, so there's shortages everywhere. Well, it seems to be a daily occurrence. Misinformation pops up on social media and then it runs wild, which leaves a lot of us in the position of trying to refute it, kind of like a never-ending game of whack-a-mole. Well, we got this notification this morning of another one that is rearing its head. Ann says, "Could you please check on a rumor? Is the Canyon County coroner reporting 56 deaths this week from COVID vaccinations and or boosters? 56 deaths just this week from the vaccine. And for some people, that's easier to believe than actual deaths from a deadly virus. And one would think that would be shouted from the rooftops if that were true, not just on social media, which is, well, where Ann heard about it, on Facebook. So we did some digging and we found the source, buried deep in a comment thread, and it says this: there are over 50 healthy people in Canyon County alone in the last couple of weeks dead from their vaccination booster. Look it up or call the coroner. They'll tell you. Well, if it's that easy, we will. And we did. And you know what Jennifer Crawford, the Canyon County coroner, told us? Well, she received a phone call earlier this week asking the very same thing. She told us she has, quote, released no such information. Information that, if it were true, would have to come from her office. So see, it took maybe 30 seconds to get the answer to that. Less time than it properly took to write that Facebook comment. But we're glad we could clear it up for you and for everybody else who may be paying attention. We're happy to clear up pretty much any rumors you see or hear. I mean, within reason. We don't know or nor do we care what's going on with your neighbor's personal life. But maybe Timex Social Club should just redo their song Rumors. Remember that from the 80s? How do rumors get started? They get started by your friends on social. Well, yeah, they get mad. Okay, you get the drift. If you're not sure if what you're seeing posted is true or what your mom's best friend's sister claims is actually happening inside our hospitals, you can always reach out to the agency directly, or you can do that to us. We're happy to help. So are they. We make it simple. Just send us a text or an email, and you can ask us to look into it, like Ann did. And like Michelle did yesterday morning when she sent us an email asking, can fully vaccinated individuals still spread COVID while being symptom-free? Short answer, yes. Vaccine does not prevent you 100% from getting COVID, just like the flu vaccine doesn't prevent you 100% from getting the flu. However, it is supposed to make the symptoms, if you should catch it, more mild. Even though you may be asymptomatic, you could still end up testing positive. Good news, spreading the virus usually happens at a slower rate if you are vaccinated. CDC says if you have had close contact with someone who has tested positive for COVID, and even if you are vaccinated, you should get tested 3 to 5 days after your exposure, within that window, even if you do not have symptoms. You should also wear a mask indoors while in public for 14 days following that exposure. So this is how you can reach us about the show. We're going to get to your comments at the end of the show. But all you have to do is text us questions, comments, concerns, even complaints about the show. 208-321-5614. Send us some good ones, and we could share yours at the end of the show. And of course, this summer, the record-breaking summer, just had to go out with a hot flash, right? Check out this meteor seen in the skies above Eagle. This happened on Tuesday night around 10:30. There you can kind of see, wow, there it goes. That is pretty impressive. Bottom right of your screen there, and then the bigger shot when it goes to the middle of your screen. Jordan Ragsdale posted this to our Idaho Weather Watchers Facebook page. And you can check out all the other really cool pictures and videos that other viewers have posted from around the 208.
We have some smoke outside, and you can still see the foothills. Looks fairly nice. The air quality actually is in the good category right now. But for tomorrow, when we look at the forecast, according to the DEQ, we're going to be looking at the moderate level air quality. Let me tell you why. First of all, what we have right now, which is according to Air Now, most locations, as you look up here to the west and to the north, are in the green, except for McCall, which happens to be yellow right now. But the valley from Caldwell all the way to Boise happens to be in the yellow category. And then when you go over here to Twin Falls, green. But look at that for Sun Valley, which they've been kind of dealing with this situation in the way of orange air quality at this point. And if you notice, our worst smoke over the summer months have come up from the south, because that's where most of your fires are, as you can see right here from Northern California. Now here's the smoke layer along Southern Oregon. This is Friday night. Look at what happens as that comes up from the southwest. A little bit more in the way of smoke, thicker, and this is by noon tomorrow. So keep that in mind as that comes in and as you look outside right now. So 81 degrees is the current temperature, and we still have calm conditions in the way of the winds. And temperatures today, 70s throughout most of the mountains, as you see. 81 for Boise, 83 for Mountain Home, 84 degrees for Ontario, and Twin Falls at 77 degrees. Looking at tomorrow and in the morning. Now, we had some lows down around 47, 48 this morning, but it remains cool for the day up to about 11, which is what I prefer when we see things going into the 70s and the 80s, that the temperature starts to get a little bit warmer, feels a little bit hotter. That is if you have a collar. When you look at 4, 5, and 6 tomorrow, temperatures will actually be moving a little closer to 90 degrees with this 88. Sunday is 92, Monday is 92, and then Tuesday, after we get through the 3-day weekend, which is another surge toward summer, it's 95 for Tuesday. Now these lows are still down into the 50s and 60s, so we still have some cool mornings, but it really heats up next week. Now the temperature into Thursday and Friday will start to drop into the 80s. You see 84 next week for Friday, but I've got this going into the following weekend, and the next week, a Monday, has a high of 73. That's so far in your temperature trend. So have a great weekend.
Idaho's such wide open spaces, wilderness pretty much everywhere, well, in the mountains anyway, but a lot of it. But if you take a trip through rural Idaho, you never know who or what you're going to find living around the next corner. And that's what happened to former Idaho Life reporter John Miller. Way back in 1998, he came across something pretty unusual on Sun Valley anyway.
In the shadows of the mountains of Sun Valley, you'll find horses,
Hi, honey boy.
barn cats, and barn dogs, but stop by Kathy Lynn's place,
Come on in.
and you'll find the Pied Piper of the alpacas.
Come on, everybody.
What is an alpaca?
An alpaca is a cousin of the llama, and they're in the camel family. Come on.
Now, they're in Kathy's family.
The alpacas are native to South America.
Of course, these are native to Kathy's backyard.
Here's Chief.
Hi, Chief.
Over here, we have an alpaca right behind you.
Hi there, buddy.
And this white girl is Annalita.
Hello, baby. And Treasure and Tonto making Kathy more than the alpaca lady.
Alpaca mama, I am now with our new babies. And he's only 2 days old, this little
He's
fawn
only
boy.
2 days old?
He's only 2 days old, yes.
You're kidding me.
No,
Him.
no, yes, the little fawn boy.
Little fawn boy.
Yes.
All cuddly and cushy and squishy.
And they're gentle, they're intelligent. They make wonderful pets for children.
And that's not all.
These are some gloves that are made out of alpaca fiber.
You guys make good gloves, huh? Making Kathy cuckoo for Cocoa Puff,
Hi, Cocoa Puff.
and all in her pack of alpacas. How do you tell them apart?
It's just like mom with your babies. You know which ones are who.
And the Pied Piper of the alpacas couldn't be prouder.
You are attached to him, huh?
I totally attached.
John Miller, Idaho's News Channel 7.
I guess the question of the day.
All right, here are all the ways you can connect with us with the 208, other than watching us on TV and sending us a text message. Facebook, Instagram, Twitter, email. You can send us an email, or you can leave us a voicemail as well, because you know how much we love hearing from you on voicemail. And if you missed any of our 208 shows, they are all available on our KTVB YouTube channel, so check those out as well. Let's get to your comments. Final minute of the show here on a Friday before a holiday. Kim says this: with people like Dr. Cole, soon to be on the board of CDH, is it any surprise the healthcare system is being overrun with anti-vaxxers, she asks. Seems to me that those individuals who have followed published guidelines and have done everything possible to prevent COVID would be prioritized at our hospitals before those that continue to challenge this virus without vaccination, says Steve. But it's kind of like if you show up to a hospital and you've been smoking and drinking, should you already just be kind of pushed to the back of the line? If we all followed the guidelines, I guess we wouldn't need the hospital very much, would we? Brian, all the non-vaccine people who are risking careers will be okay. I see a lot of help wanted signs all over the valley. Terry says that from Payette, who's retired and vaccinated. Thanks for the coverage on the healthcare workers. I'd like to remind viewers that should we end up activating crisis standards of care, those most likely to live will be prioritized, meaning those who are vaccinated, reminds Erin of Boise. She's a physician assistant, by the way. She knows. And we'll leave you with this on this holiday from Roy. Thank you, healthcare workers. Words can't express how much we appreciate all you are doing and have done for the last 18 months. See ya next week.